Trigger finger is a condition that often causes locking of any finger of the hand. Most commonly, trigger finger affects the ring finger and the thumb. It's also called stenosing tenosynovitis, but it's obviously easier to call it trigger finger. What happens in this condition is the tendons that allow us to move our hands like this actually get stuck, so to speak, in the sheath, like the covering of the tendon, or basically the tunnel that they have to travel through in order for us to be able to move our fingers freely. A lot of times this occurs in people that use their hands a lot, and trigger finger might develop just from simple overuse. And typically, if a patient with trigger finger were to go see their doctor, they might be recommended to get a steroid shot to decrease the inflammation of the tendon and the sheath and allow everything to move more freely. In theory, that sounds nice, but the reality is that steroid shots actually increase risk of tendon rupture, which is why people are limited to the number of steroid shots that they could get each year. And people with trigger finger a lot of times may undergo a steroid shot only to find that everything just really comes right back sometime later. Maybe they get a second steroid shot, the same thing happens, and then eventually they're recommended for surgery. What we do is oftentimes a combination of what we call a hydrodissection procedure along with prolotherapy. And what that involves is using a non-steroid injection actually into that tendon sheath to draw off swelling, kind of unstick any adhesions that might be there from chronic overuse, and allow that tendon to move more freely through that tunnel. Prolotherapy may also be warranted in these cases because a lot of times what we see is, let's say someone has trigger finger of their ring finger. It often goes hand in hand with injury, arthritis or things to any of these joints, along the path of that tendon. And so by doing, a hydrodissection procedure to kind of free up that tendon in that tunnel, and then also doing prolotherapy to strengthen, any injury, strengthen any joint or fix any injury in these fingers, those procedures work really well hand in hand to get trigger finger to resolve.